All right, in this explainer, we're going to dive into a battle that's happening inside millions of joints right now. It's this silent conflict that, usually gets just one name, but it's actually a war being fought on two totally different fronts. We're talking fire versus rust.
You know that ache, right? That stiffness, that pain you feel in your joints? Well, it's not just random noise. It's actually a really specific signal your body is sending you. But to figure out what it's saying, you've got to learn the language first.
So, to get to the truth of it, we're going straight to the source. We're digging into the clinical research files of a Dr. Louis Campanella to, decode that signal for you. We're not just skimming the surface here looking at symptoms. Now, we're actually investigating the source code of your joint pain.
So let's just get right to it and ask the most important question. What is your joint pain really trying to tell you? Is it a warning sign of some kind of smoldering internal fire, or is it the result of a slow, grinding, mechanical rust? Because trust me, the answer to that, well, it changes absolutely everything.
Okay, let's dive right in. The first, and maybe the biggest problem we need to tackle, is something Dr. Campanella's files called the joint matrix confusion. And really, it all boils down to this. We have a bad habit of using one single name, arthritis, for two completely, fundamentally different enemies.
And look, the stakes here are incredibly high. As the files point out, this confusion, it leads to treatments that are pretty much guaranteed to fail. Why? Because they're aimed at the wrong enemy. It's kind of like trying to put out a house fire with a wrench. It just doesn't work.
So here it is, the core distinction. On one side, you've got the fire. Think of this as an active internal assault on your own body. And on the other side, the rust. This is a slow, mechanical decay of the joint itself. It's happening on the same battlefield, your joint, but these are two completely different wars.
All right, first up, let's investigate the fire. Now, when most people hear the general term for joint pain, this is usually what they picture. But it's so important that we get specific here. What we're really talking about is arthritis. Now, what's so wild about this is the cause. See, arthritis is an inflammatory process. It's often an autoimmune problem, which means your body's own immune system gets confused and starts attacking the lining of your joints. It's literally like a civil war happening inside your own body.
So how do you know if you're dealing with the fire? Well, the clues are very, very specific. First clue, you get this intense morning stiffness that can stick around for more than an hour. And here's the really weird part, the thing that might throw you off. The pain often gets better when you start moving around, but then, the moment you rest, it comes right back.
Okay, now let's cross to the other side of the battlefield. It's time to investigate the rust. Clinically, this enemy is called arthrosis, but you probably know it by its much more common name, osteoarthritis.
And this slide just perfectly highlights the difference. Osteoarthritis is not an inflammatory attack. Not at all. It's a mechanical problem. It's the physical wearing down of that smooth cartilage that's supposed to cushion your bones. It's caused by stuff like aging, overuse, a previous injury, or maybe carrying a little extra weight. It's pure and simple, wear and tear.
And get this, the clues for rust are basically the exact opposite of fire. It's like a mirror image. That morning stiffness, it's usually pretty brief, less than 30 minutes. The pain is totally mechanical, meaning it gets worse the more you use the joint. And, well, it makes sense, it gets better when you finally stop and rest.
So if we're dealing with two totally different enemies, it just makes sense that we'd need different weapons to fight them, right? You just can't go after fire and rust with the same old battle plan. It won't work.
Okay, let's just lay all the evidence out, side by side. Take a look. Morning stiffness? Over an hour for fire, but less than 30 minutes for rust. The pain pattern? Fire gets better with movement, rust gets worse. And the root cause? An immune system assault versus straight-up mechanical wear. I mean, the distinction couldn't be clearer. And that logically brings us to the treatments. To put out the fire, to treat arthritis, the weapons are all medical. We're talking anti-inflammatories, special disease-modifying drugs, and biologics. And every single one of them is designed to do just one thing: calm down that internal immune assault. But for rust, the strategy is a whole different ballgame. You can't fight a mechanical problem with those immune-suppressing drugs. The tools here are mechanical too. Things like weight loss to take the load off the joint, physiotherapy to build up those supporting muscles, and sometimes injections to help lubricate the worn-out parts.
Okay, so understanding which enemy you're facing, that's step one. That's huge. But step two is knowing what you can do about it, starting right now. So let's talk about your home action plan. how you can really, truly get a grip on all this.
Now, here's a really fascinating piece of the puzzle. There is one weapon, one universal medicine that actually works against both enemies. And what is it? Targeted exercise. So why does it work for both? Well, because stronger muscles around a joint act like your body's own internal shock absorbers. They take the stress off the joint. Doesn't matter if it's on fire or if it's rusting away.
But beyond that one universal tool, you really have to tailor your home care. So if you're dealing with the fire of arthritis, you want to focus on things like an anti-inflammatory diet and use cold packs for those bad flare-ups. But if it's the rust of arthrosis, then weight management is priority number one, and you can use heat to help soothe that mechanical stiffness.
And this all leads us to a final, really powerful quote from Dr. Campanella's files that just sums up everything we've talked about perfectly. You don't fight fire with weight loss alone, and you don't fight rust with immunosuppressants. It's simple, really. Know your enemy, choose the right weapon.
So, that signal your body was sending, it's not a mystery anymore. The code has been cracked. You now have the information you need to tell the difference between the fire and the rust. So the only question left for you is, are you ready to get a grip